Hey, morning everybody. Really glad to be here. I'm being challenged. They typically tend to move, but they put me behind a podium, so let's see what happens. At any rate, in the next 10 to 15 minutes, what I'm going to try and do is plot a map of what's currently being done and what are the future challenges and how does AI and healthcare play together. Keeping in mind that I come from the, let's say, computer science part of the game and not the health part of the game. Okay, let's do this. Cool. So I'll start by saying that, right, if you guys come from the health research, health systems, you know that the challenges or the technology challenges did not change for quite a long time, right? A few decades, basically. We still need to provide better care. We still need to do that more efficiently. We still need to find personalized treatment and to find new drugs and so on and so forth. The challenges did not change that much. What did change is the technology environment around us, right? For sure, AI today does not look as AI looked like, let's say, 5 years back. We've got much better sensing, much better sequencing tools, much larger data resources. Compute is much cheaper. IoTs are much more capable, and so the entire thing is shaping around us. What I tried to do today is go from the needs to the data, talk a little bit about the tools, and finalize with Israel's unique location in this global arena. So here it is, right? 4 high-level challenges for healthcare research, technology research, starting with medical treatment. Matching the exact or the most specific dedicated treatment for our specific patient. Going to diagnostics, moving to clinical development, that is, how do we plan a clinical trial to maximize the chances of this device, of this new drug becoming a reality. And finally, therapeutics, how do we design new drugs? And AI is kind of providing new answers to all of those very old challenges. Let's go. Okay, so with those challenges in mind, we do see major technology shifts in recent years, and I'll try to kind of put them in bullet points. Better? Oh, sorry for that, and thank you for raising it. So first thing first, we're moving from what's called single source to extreme multimodality. Okay, so with AI, we always talk about multimodalities, right? We talk about images being combined with text and so on and so forth. But when it comes to healthcare, we've got tons of modalities. We've got omics, we've got imaging, we've got medical records, we've got text literature, health-related literature, and we've got many more new types of data that are being introduced as our sensing capabilities improve as well. And this is really an extreme. I don't think there is any other domain of modern AI where so many modalities need to be integrated together. Second thing is what we see right now is a move from narrow, single-tasked AI to something that is more holistic. Okay, you can think of it as we've seen similar moves going in other domains of AI research, but and I think the most notable ones are what happened with large-scale models, LLMs, visual models, and so on and so forth. We started with models that were trained to solve just one problem, and we ended up with models that are generic in the sense that we can suit them or fine-tune them to solve many different problems. We see a major trend in the ability to produce new data. More data, new types of data, data that is now becoming allows us to sequence or to measure a given patient throughout time, moving from single cells to complete tissues and so on and so forth. So the amount of data is growing tremendously, the cost of data is being reduced, and the types of data that are being added are being diversified as we speak. And finally, and this is also something that we really need to take care of, right? We know that those large models are unexpected in a way, right? So when my favorite chatbot produces a wrong answer, that probably doesn't cause too much damage. But when it comes to designing a clinical trial or actually treating a patient, those hallucinations are all of a sudden very important. And this is something that we'll all need to kind of tap into looking forward. Going a little bit more, each of these specific challenges, of course. So with medical treatment, it's all about personalization, right? We got this given patient, we got the medical records, we've got past treatments, we've got diagnostics results for this specific patient, and we're trying to, at the given scenario, design the most suitable treatment at this time. This is the main challenge, and admittedly, up until today, what we had is mostly decision support system and even low-level decision support system. We relied heavily on the human expert to take the decision in its given context, and what we're hoping to see in the future is AI systems that move up the scale of automation and autonomy. Second challenge, of course, is diagnostics, from early disease detection to genetic diagnostics and so on and so forth. Indeed, in the last few years, we've seen tremendous leaps forward when it comes to medical imaging, right? Everybody knows AI Doc, Zebra Medical prior to that, all its competitors, right? We've seen wonderful results for pathology as well. So images are being treated quite well. But what we did not see is the ability to actually integrate specific tasks or specific type of data with additional types of data. So that's where we stand right here. We've got a very promising domain, but a lot to be done in the future. Going to clinical development, I think that might be the let's say, more, let's say, not so much spotlight has been put on this, at least in let's say, in what's called in the press. But as you all know, a small percentage of new treatments, of new medical devices, of new drugs will actually be transformed or be approved for use, right? And one of the hardest part, one of the main reasons that most of them fail. They will fail in the lab, they will fail throughout the process of the clinical trials, right? And one of the most important things we can do is make the best use of a given drug or a given clinical experiment. Let's take an example. Suppose I've designed this new drug. It's working wonders for women, but it doesn't work that well for men. But my cohort includes 50% of each gender, right? And then I'm getting back my results from the clinical trial. It took me long months, a lot of money invested in the process, right? A lot of bureaucratic processes, ethics committees, and so on and so forth. By the end of the day, it did nothing for men, okay? But the part of my cohort that is women is not large enough to provide statistical evidence to actually approve the drug at the end of the game, right? Now, I've wasted, I don't know, a year and a half, tons of budget. Chances are that I will not go through a second clinical trial because it's simply too expensive. But what if I could predict it in advance and set my cohort towards, my expected results? So that's kind of one of the things that we hope to see in the future. Finally, therapeutics. I think this is like the well-known challenge. We want to design new drugs, right? We want to design the structure of molecules, the functioning of the molecule, the toxicity of molecules, whether a given molecule can serve more than one purpose, and so on and so forth. Again, we've seen major advances in AI technology toward this direction in the last recent years, and we still want to see more. A few words about data, right? The one thing I want to leave you with is that medical data is extremely diversified. We start with text, of course, EHRs, clinical notes, publications, and then we use the usual suspects, NLP tools, right LLMs, and so on and so forth. We go to sensory data, multimodality sensory data, we have X-rays, MRIs, pathology, EEG, EKG, omics, EHR, and so on and so forth. Tons of different types of modalities and inputs. And quite frankly, we don't yet know how to bind them all together. Clinical data, of course, patient records and lab results and vital signs, so on and so forth, right? And eventually, molecular data, genomics, proteomics, metabolomics, and so on and so forth, right? Again, what I want to leave you with is that we're going to see more and more types of data, more and more data records, and additional ways of gathering the same data. And our main challenge looking forward is to combine them all together in a multimodal way. Same as we've seen with the recent, LLMs, it's that we can talk to the data, right? I think that's the main challenge standing in front of us. Instead of defining a task and then designing a model that can solve the task, now what we see in text or in images that we can talk to the model, right? We can talk to our data and get new insights. And potentially this is where we want to be with health-related and medical data as well. And here is the summary slide. I like it, right? So we've got tons of types of data, different challenges, and as we see how all those types of data interact in a specific context. Again, supporting the sense that we need to find more integrative solutions. One word about the Israeli health tech AI ecosystem. There are approximately 500 or 600 companies in Israel. Not to say, of course, tons of academic work. Many of the largest data sets are here in Israel. Plenty of knowledge. And if there is one thing that we do well in Israel is combine different disciplines of research or different backgrounds of people, right? It's very easy here to find people coming from health, people coming from biology, people coming from engineering, people coming from computer science, and they meet together and solve challenges together. And that's the true thing that we need looking forward. Finally, a few words about the future, although I gave you a lot of hints. We definitely want to go towards more automation. What we have today mostly is decision support system in different levels, where the human remains at the center of the decision-making process. What we're going to see, and this is a spectrum, right? We don't move from 0 to 1. It's not like today we've got a low-level decision system, and then tomorrow we're going to have a fully autonomous system. But what we're going to see is move towards this higher level of automation and autonomy. Multimodality, said a lot of that, talked about that quite a bit in my presentation so far, but definitely is this the kind of thing where we are looking to see breakthroughs in the next coming years. Data, again, the trends of increased quantity, increased diversity, and higher quality as a result of the thing becoming cheaper, new sensors being integrated, new methods for gathering data, for processing data, and so on and so forth. And finally, algorithms. And this may be somewhere to pause for a minute. The reason why LLMs are so successful is that because they were trained over half the internet. So I often meet with biologists or people coming from the health system and say, we've got tons of data. Yes, you've got a lot of data, but it's not tons of data. Talk to the guys that train LLMs, they'll say, you've got, I don't know, 5, 6 orders of magnitude less data than what's typically done with LLMs. And that means that the algorithmic solutions will have to compensate for the scarcity of data, right? Yes, you've got, I don't know, 30,000 patients being sequenced for DNA, RNA, whatever, right? How many times did you sequence this single person? Just one? Okay. Do you have the complete medical record of this person aligned with the sequencing? No. Okay. So you've got those islands of data, and they're, trust me, guys, compared to the things that are being done in text or in video and audio, we've got tiny amounts of data, and therefore the algorithmic part will have to compensate for this scarcity. Finally, of course, we will all need to make sure that our solutions are trustworthy, that people can trust them. that they are not biased, right? That they're not affected by all the issues that we have with computer systems, regardless of their domains. And this is something that we have to evolve side by side with the rest of the technological evolvement. And I think with that, I'll say thank you guys. May we have a wonderful day.